Hey all. For all of you who are going to join and watch later, we're going to talk about grinding and dental splints. I'm just going to wait for more people to join to show you what a splint is. So I'm gonna wait for a couple more people to join, but while you're waiting, I don't want to bore you. I'm just gonna show you what is an occlusal splint. So if you have any questions, if you're a dentist, if you are interested, if you're a patient, keep shooting your questions. I'm here for you. I'm at the clinic. There you go. And I have, I think, 15 minutes before my next patient, so we can have a chat. Now, this is the occlusal splint. This belongs to one of my patients who have not been used. And the reason that we put this on and use it is mainly because the person grinds. Now, this basically, imagine if this is your mouth, this is how the splint goes in, so you wear it like this. And this provides like a cushion between your upper and lower teeth. So you physically cannot touch them and grind them and break them and basically damage your own teeth, which happens a lot. Most people grind. The reasons for dental grinding is mainly stress of modern life. It's subconscious. Sometimes it can also be your bite, if your bite is not correct, or a combination of both. So how can it be bite? If the problem with your grinding is your bite, it's because your teeth are supposed to basically fit in together like this, but they don't, they're like that, right? So when you bite, it's like this. So when you sleep, your teeth are continuously moving and trying to find a correct position or a comfortable position to be able to relax your muscles, and that is called grinding. So one thing that can really help when you're a grinder or a boxer would be to do orthodontic treatment, although this can only be confirmed if you talk to an orthodontist or a dentist who does orthodontics. But in general, three things are recommended. So let's say the first thing that we recommend is relaxation therapy or yoga or something that would basically relax you, especially before bed. So if you could do meditation before bed, it is really good. Hang on a second. I'm on the live.
I need your opinion with something a bit important.
Okay. I'll be back. Sorry. I can't start this.
Why can't you?
Because it's middle. All right, I'm so sorry, but you know, it's not the best thing to go live while you're working and managing a dental clinic. But on the other hand, if you want to think like that, there is almost no good time to do it. So as I was saying, the first thing that we recommend for dental grinding, for bruxers, for clenchers, especially the ones who do it more during sleep, is to have meditation, relaxation therapy, something to relax you before bed. That really helps, because these things, it's called a parafunctional habit. It's not something you can control. It comes subconsciously, and if you do relax your mind before bed, it will really help you clench and grind less. That's one thing. Now, if you have any questions, please comment below. I'm gonna find out how to see the comments. There you go. All right. So that's one thing. The second thing is this splint. If you put this splint on, it's going to help you not be able to grind. So you put it on your teeth. Let's say these are your teeth, right? You wear the splint on, and it will help you, because you cannot grind anymore. Basically, it separates your upper and lower teeth, and it provides a cushion effect between them. The main danger when you're grinding is for your teeth first, because they are so strong that they can rub against each other, break each other. You might fracture the tooth so bad that you have to pull it out. And on the other hand, there is so much pressure on your muscles here and your joints here. Remember, when you're sleeping, you're supposed to be relaxing all these muscles, because it's the one time that hopefully you're not talking. So that's something to consider. First was meditation, relaxation. This one, which is the occlusal splint. And the last thing is Botox, or we're not supposed to say Botox anymore, anti-wrinkle injections, whatever that's gonna relax these muscles. These muscles are called masseter muscles. They are the main muscles that cause clenching and grinding. Now, if you paralyze them, you physically cannot clench and grind anymore. So that will help with the situation you have. There are a couple of things to consider. First of all, you have to repeat it once every 3 to 6 to 8 months, because the effect goes away. Remember that it's not going to change your looks. So that's all right. So people sometimes worry. Although if you do it repeatedly, what happens is that your muscles here are not used as much, so your face will a little bit go in, which most people like it, to be fair, because it kind of makes you have more cheeks. What else I can tell you? That's basically it. These are the 3 ways to stop or prevent grinding. The best way for it, as I said, is mindfulness and meditation, relaxation. The guard and Botox or anti-wrinkle injection, or whatever injection that can paralyze temporarily these muscles that are for clenching and grinding. Another question people ask is, can I still chew my food? Yes, you can still close your mouth and chew your food. For chewing, we have 3 other muscles that are gonna help. If you have any questions, comment below. Because this is basically what I want to show you about clenching and grinding. It's a very big thing in dental world. It can give you heavy headaches that don't go away. It can break your teeth, it can fracture your teeth, you might lose your teeth. So having something to stop grinding and clenching is amazing. Now, one thing that people complain about these, it's huge, as you can see, it goes all the way to the back. You have to get used to wearing them. It's not easy, because many people say they pay for it and it's not cheap. So right now, I would say in Australia, you can find it anywhere between $500 to $1,000. Every 2 years, I would say the latest, you want to change them, as in it becomes yellow, it becomes yucky, you don't like it anymore, it's not hygienic, you cannot clean it anymore. So you might want a new one. So as it's not the cheapest product to buy, you want to take care of it, but you also want to use it. And I see it, I would say, at least in 40% of patients who pay for it and buy it, but they do not use it because they say it's too big, you know, it's annoying, I don't like it. You have to give it some time. I would say you have to give it like 2 weeks to get used to it. And also it has to be as comfortable as possible. It shouldn't give you pain. It shouldn't push on some of your teeth in a way that it's painful. So that's another thing that you have to consider. If you feel like it's big, talk to your dentist, but we have to give it some sort of thickness. Otherwise, what's the point of wearing it? That's basically all I wanted to tell you about occlusal splints, bruxism, grinding and clenching. I'll hang around a little bit longer. If you have any questions, please comment below. Otherwise, I will see you at my next video. for the like, by the way, whoever liked the video. Dr. John, I liked it. Oh, thank you so much, Rabbit. Thanks for watching.